In your workplace, what do you find the benefits of participating in the clinical education of students?
Well, there's no doubt that having students is a great advantage to our service. They bring with them a wealth of enthusiasm and up-to-date treatment procedures that have been taught by the universities, which is contemporary to our practice. So for us, it's a two-way learning experience for the students and for us. Our educators have a lot of practical and lots of experience, but we both gain major benefits from the two meeting up together.
Megan, what have you found to be the key features to run a successful placement?
Communication is one of the major key features from beginning to end to run a successful placement. And we have our clinical educators who we actually divide into a primary and a secondary educator. We communicate with them via guidelines that we have drawn up and are sent to both the educators and the students before their actual placements. Within this are just many aspects of what to expect during the placement. For the educators, there'll be information on the mid and end term assessments and other relevant things to do with our actual placement within the community service. And for the students, there'll be other things to expect that they might not have come across in other previous placements, because the community and the aged care settings are going to be so very different from other placements that they've been in, and we really don't want it to be a total shock for them. Yeah. And this is one of the reasons why I will meet up with the clinical educators and the students on the very first day, just to go through with them what is going to be expected so that they feel good about the placement. We want them to be part of the team, and that's another reason why we want to really try to incorporate a good team meeting right at the beginning of the placement.
Okay. Megan, do you have any tips for other clinical educators, either generally or specifically relating to your practice setting?
Information is the key. And as I've said before, we do send out quite a lot of information. We meet with the student first thing so that they are fully aware and informed of what's they're in for in the next 5 weeks. And because I personally think we need to start these students very early getting involved. Some of these students are going to be working within the next few months. They're going to be qualified. So early starting with patients is a must. Getting them involved, getting them within the team so that they feel like they're working within a team. Important for them that they really enjoy the experience, because a lot of our students will actually come back to us, and it's a great marketing strategy for mobile rehab, because we have students who come back to us and work for us later on.
Wonderful.